you tell us what you're learning about children who are testing positive for COVID-19? Is there anything new about their symptoms, anything new about their treatment across the city?
Yeah, so we actually got our biggest data set about pediatric COVID infections earlier this week from the CDC, and it covered about 2,500 cases of COVID infections in the US. And what we learned from that is what we're largely seeing now that we are seeing COVID infections in Boston as well, which is that still the majority of infections in children tend to be with very mild symptoms. Children who are testing positive do still tend to have at least one of the three most common symptoms, which would be fever, cough, or shortness of breath. And that true throughout the rest of the U.S. cases, and it's certainly consistent with what we're seeing so far in pediatrics in Boston.
And it's good to have that data to be able to look at. Kids are all home. My kids, I know, they want to see their friends. Is there any way that it's safe to do this right now?
I think that families just need to be really, really considerate about how feasible that is with appropriate maintenance of social distancing. A part of that consideration, too, would be how old the children are in terms of whether or not they're going to be able to really maintain 6 feet of social distancing at least. So maybe for older children who could absolutely understand that, it might be reasonable to plan that they were out for a walk somewhere if they could stay 6 feet apart, or maybe a bike ride if they could stay 6 feet apart. But certainly any contact sports or any pickup basketball games, anything like that would not make the social distancing parameters feasible. So that really needs to be considered.
Yeah, think about the age appropriateness. So of course the pandemic doesn't stop kids from getting bumps and bruises, from hurting themselves. Should we assume that our pediatricians can't see kids for minor injuries right now, or how have pediatricians kind of adjusted?
Yeah, so every pediatrics office is maybe taken a slightly different approach, but I think for the most part, they all are really doing their best to do any COVID concerning visits virtually so that those patients are not going into offices. Most pediatricians' offices are still definitely prioritizing being able to keep their offices open for well child visits, particularly for very young children who need to get immunizations very regularly so they can stay on track with their vaccines. And then when it comes to other urgent care needs, I think it's always good to just start with a phone call to your pediatrician's office to see what they're able to do either virtually or whether they might refer to an emergency department or urgent care center.
All right. Thank you so much, Dr. Kristen Moffatt. We appreciate your time.
Sure. Thanks for having me.